Over 60, never drink beet juice. With these 7 foods, it can cause serious health problems. If you are over 60 and drinking beet juice for your heart, blood pressure, or energy, this message is especially for you. Beet juice is often praised as a powerful natural healer. But what many seniors are never told is that mixing it with the wrong foods can quietly trigger serious health problems. Dizziness, dangerous blood pressure drops, kidney stress, and medication interference don't happen overnight. They build silently. For aging bodies, food combinations matter more than ever. Knowing what not to mix with beet juice could protect your heart, your balance, and your independence. If you care about staying healthy, steady, and strong after 60, take a moment to subscribe to this channel. Like this video so more seniors can stay safe. And comment yes if you want honest, doctor-guided food advice made especially for people over 50. Beet juice lowers blood pressure by increasing nitric oxide, a compound that relaxes and widens blood vessels, allowing blood to flow more easily. Many doctors acknowledge this effect and often describe beet juice as a natural vasodilator. For adults over 60, this property can seem beneficial, especially for heart health. But it becomes risky when beet juice is consumed alongside prescribed blood pressure medications designed to do the same job. Blood pressure medicines such as ACE inhibitors, beta blockers, calcium channel blockers, and diuretics are carefully dosed to lower pressure to a safe range. When beet juice is added on top of these medications, the combined effect may push blood pressure to low. Some doctors warn that this interaction can lead to sudden drops, especially after meals or when standing up, a condition commonly called orthostatic hypotension. In older adults, low blood pressure can be just as dangerous as high blood pressure. Research shows that overly reduced pressure may decrease blood flow to the brain, increasing the risk of dizziness, blurred vision, weakness, and confusion. Seniors may feel unsteady on their feet, which raises the risk of falls, fractures, and head injuries, even during simple daily movements. Doctors often emphasize that aging bodies respond differently to both foods and medicines. Kidney function slows with age, and this can affect how quickly blood pressure, drugs, and dietary compounds are processed. Beet juice, taken regularly, may intensify medication effects over time rather than immediately, making the danger harder to notice until symptoms appear. Some studies examining dietary nitrates note that while they can support circulation, they should be used cautiously in people already receiving antihypertensive treatment. Medical professionals frequently advise that natural products capable of lowering blood pressure should not be layered on top of prescription therapy without supervision. This guidance is especially strong for adults over 60, whose blood pressure regulation systems are more sensitive. Another concern doctors raise is inconsistency. Blood pressure medications are taken in controlled doses, while beet juice amounts often vary day to day. One glass may contain far more nitrates than another, leading to unpredictable blood pressure changes. For seniors, this variability can cause sudden lightheadedness, fatigue, or fainting without clear warning. Healthcare providers regularly remind older patients that natural does not automatically mean safe together. Beet juice is a food, but its physiological effects are powerful. When combined with blood pressure medications, it may silently undermine the balance doctors work to maintain. Many physicians recommend avoiding beet juice entirely or consuming it only under medical guidance when blood pressure drugs are part of daily treatment. Medical advice often focuses on prevention because the warning signs of low blood pressure can be subtle. Seniors may blame tiredness or unsteadiness on age rather than an interaction between food and medication. Doctors encourage regular monitoring and clear communication about dietary habits, including vegetable juices. For many adults over 60, the safest approach is avoiding beet juice while taking blood pressure medicines, unless a healthcare professional specifically approves it. This caution is meant to protect stability, circulation, and overall safety, not to discourage healthy eating. Maintaining steady blood pressure is a key part of preserving independence and reducing avoidable health emergencies in later life. This combination risk increases during hot weather, dehydration, illness, or missed meals in seniors daily. Beet juice contains significant amounts of vitamin K, a nutrient known to affect how blood clots in the body. Blood-thinning medications such as warfarin, aspirin, and clopidogrel are prescribed to reduce clot formation and lower the risk of heart attack or stroke. When beet juice is consumed regularly alongside these medications, doctors warn that vitamin K may interfere with how effectively the drugs work, especially in adults over 60. Warfarin is particularly sensitive to vitamin K intake. Research and clinical guidance explain that vitamin K can counteract warfarin's action, making the blood more likely to clot than intended. For seniors, even small changes in vitamin K consumption can shift blood clotting levels outside the safe range. Beet juice, often taken in concentrated amounts, may introduce more vitamin K than expected, increasing the risk of reduced medication effectiveness. Aspirin and clopidogrel work differently from warfarin, but doctors still caution against combining them with foods that strongly affect clotting pathways. Some healthcare providers note that while these medications are less sensitive to vitamin K, dietary changes can still influence overall clotting balance. In older adults, this balance is already fragile due to age-related changes in blood vessels and circulation. One of the main concerns doctors raise is inconsistency. Blood thinners are prescribed in stable doses, but beet juice intake often varies from day to day. One glass may be small, another much larger, leading to fluctuating vitamin K exposure. Studies on anticoagulant management emphasize that unpredictable vitamin K intake can cause dangerous swings in clotting levels, increasing the risk of either clot formation or excessive bleeding. For seniors, these swings can have serious consequences. If blood thinners become less effective, the risk of stroke, deep vein thrombosis, or heart attack may rise quietly without obvious warning signs. Doctors explain that clotting problems do not always cause pain or immediate symptoms, making prevention especially important after 60. Healthcare providers frequently advise either strict consistency or avoidance when it comes to vitamin K-rich foods and blood thinners. Beet juice poses a special challenge because it is often consumed for perceived health benefits, sometimes daily, without realizing its interaction potential. Medical guidance often suggests that if vitamin K intake cannot be kept consistent, it is safer to avoid concentrated sources like beet juice. Altogether, another issue noted by clinicians is that seniors may combine beet juice with medications believing that natural foods are harmless. Many doctors stress that food can act like medicine in the body, especially when consumed in juice form. Concentration matters, and beet juice delivers nutrients in amounts far higher than whole beets eaten. Occasionally, research in anticoagulation care consistently highlights the importance of dietary awareness. Patients over 60 are often advised to inform healthcare providers about juices and supplements, not just pills. This is because interactions can quietly undermine treatment goals that are meant to protect the heart and brain. Doctors often remind older adults that managing blood thinners is about stability, not extremes. Avoiding beet juice while taking warfarin, aspirin, or clopidogrel is commonly recommended to reduce unnecessary risk. This guidance is intended to prevent dangerous clotting changes, protect circulation, and support long-term safety in later years. This caution helps seniors maintain predictable treatment results and avoid silent complications that can become life-threatening without early warning signs later on. Beet juice contains naturally high levels of oxalates, compounds that bind with minerals like calcium in the body and are filtered through the kidneys. As people age, kidney function naturally slows, making it harder to process and remove excess oxalates efficiently. When beet juice is consumed regularly after age 60, doctors note that this added oxalate load can place extra stress on aging kidneys. Spinach, nuts and almonds are also well known for their high oxalate content. Nephrologists explain that eating or drinking multiple oxalate-rich foods together causes these compounds to accumulate more rapidly in the urinary system. When beet juice is combined with foods like spinach salads, nut snacks, or almond-based products, oxalate levels may rise beyond what the kidneys can comfortably handle. Research on kidney stone formation shows that oxalates are a major contributor to the most common type of kidney stones, known as calcium oxalate stones. In adults over 60, the risk of stone formation increases due to reduced kidney filtration, lower fluid balance awareness, and changes in mineral metabolism. Doctors warn that stacking oxalate sources can accelerate this process without obvious early symptoms. Kidney stones often develop silently. Many seniors do not feel discomfort until a stone grows large enough to block urine flow, causing sudden and severe pain, nausea, or blood in the urine. Medical professionals emphasize that prevention is far safer than treatment, especially for older adults, since kidney stones can lead to infections, hospitalization, or another issue raised by specialists is that kidney stress may not cause immediate pain. Gradual crystal buildup can occur over months, making it difficult for seniors to link symptoms back to dietary habits. Fatigue, urinary changes, or flank discomfort may appear later, at which point damage may already be underway. Medical guidance for adults over 60 often emphasizes avoiding unnecessary risks. Nephrologists regularly recommend that seniors do not stack high-oxalate foods, especially in concentrated forms like juices. Avoiding beet juice alongside spinach, nuts, or almonds is considered a protective step to reduce kidney stone risk and preserve kidney health. This advice is not meant to create fear around vegetables, but to encourage thoughtful combinations. Aging kidneys benefit from moderation and balance. By avoiding this particular pairing, seniors can lower the chances of painful kidney stones and protect long-term kidney function, which plays a critical role in overall health, energy, and quality of life as the body ages naturally. Beet juice contains natural sugars and carbohydrates that can raise blood glucose levels quickly after consumption. Although it is often viewed as a healthy, plant-based drink, endocrinologists explain that juicing concentrates sugars, allowing them to enter the bloodstream faster than when whole vegetables are eaten. For adults over 60, this rapid absorption can be especially problematic when blood sugar control is already fragile. Diabetes. Medications are carefully prescribed to keep glucose within a stable range throughout the day. These include insulin, metformin, sulfonylureas, and other glucose-lowering drugs. When beet juice is consumed alongside these medicines, doctors warn that blood sugar levels may become unpredictable. A sudden rise followed by a rapid drop can occur, increasing the risk of both hyperglycemia and hypoglycemia in older adults. Research on glycemic response shows that liquid carbohydrates cause sharper glucose spikes than solid foods. Beet juice, particularly when consumed in larger glasses, delivers sugar without fiber to slow absorption. Endocrinologists note that this effect can overwhelm the timing and dosage of diabetes medications, leading to swings that are difficult to control, especially after age 60. The risk increases further when beet juice is combined with high-sugar foods such as pastries, sweetened cereals, desserts, or sweetened beverages. Doctors caution that stacking sugar sources can push glucose levels dangerously high in a short period. For seniors, these spikes may contribute to fatigue, blurred vision, increased thirst, frequent urination, and difficulty concentrating. Unstable blood sugar is not just uncomfortable, it can be dangerous. Medical studies associate repeated glucose spikes with damage to blood vessels, nerves, kidneys, and vision over time. In older adults, these complications may progress faster and recover more slowly. Endocrinologists often stress that steady glucose control is more important than short-term dietary trends. Another concern raised by healthcare providers is that beet juice is often consumed for perceived heart or energy benefits, sometimes daily and without measuring portions. This makes blood sugar responses harder to predict. Unlike medications, which are consistent in dose, homemade or store-bought beet juice can vary widely in sugar content, increasing the risk of unexpected glucose sudden changes. Medical professionals emphasize that dietary caution is not about restriction, but protection. Aging bodies process sugar differently, and avoiding known triggers helps medications work as intended. This careful approach is widely encouraged to reduce complications and maintain daily stability in later years. Safety remains the priority. Beet juice enhances iron absorption in the body by improving circulation and supporting nutrient uptake in the digestive system. This effect is often viewed as beneficial, but doctors explain that for adults over 60, increased iron absorption can become a concern. Aging bodies regulate iron differently, and excess iron is not always easily eliminated, especially when supplements or iron-rich foods are consumed at the same time. Iron supplements are commonly prescribed for anemia, fatigue, or low hemoglobin levels. Iron-rich foods, such as red meat, liver, and fortified products are also widely consumed for strength and energy. When beet juice is added to these sources, healthcare providers warn that iron absorption may increase beyond what the body actually needs. For seniors, this can slowly lead to iron accumulation rather than balance. Research shows that excess iron can be stored in organs such as the liver, heart, and pancreas. Over time, this buildup may contribute to oxidative stress and tissue damage. Doctors note that older adults are more vulnerable because age-related changes reduce the body's ability to regulate mineral storage efficiently. Conditions such as hemochromatosis, which causes iron overload, may worsen silently when iron absorption is enhanced. The liver is often the first organ affected by excess iron. Medical studies associate iron overload with liver inflammation, scarring, and reduced detoxification ability. For seniors, liver stress may lead to fatigue, digestive discomfort, or abnormal blood tests. When beet juice is consumed regularly, alongside iron supplements, doctors caution that these risks may increase without obvious early symptoms. Cardiologists also raise concerns about iron accumulation in the heart. Excess iron may affect heart muscle function and contribute to irregular rhythms or reduced pumping efficiency. In later years, the heart is already working harder to compensate for aging blood vessels. Adding unnecessary iron stress may increase cardiovascular strain in susceptible adults. Another issue noted by healthcare providers is that beet juice is often consumed daily for perceived health benefits. Unlike iron supplements, which are usually dosed carefully, beet juice intake can vary widely. One serving may significantly enhance iron absorption, while another day's intake may be lower, creating unpredictable foods that alter nutrient absorption. Medical professionals generally recommend moderation and medical guidance when combining beet juice with iron supplements or iron-rich foods. Avoidance may not always be necessary, but caution is strongly advised. For adults over 60, monitoring iron levels and discussing dietary habits with healthcare providers helps ensure safety. The goal of this guidance is protection, not restriction. Beet juice has properties that affect the body in powerful ways. Using it carefully helps prevent unnecessary stress on vital organs. Doctors encourage seniors to prioritize balance, stability, and informed choices to support long-term heart and liver health in later years. Beet juice and alcohol both influence blood pressure and liver activity, which makes their combination risky for adults over 60. Beet juice naturally widens blood vessels and can lower blood pressure, while alcohol also causes blood vessels to relax, especially in the hours after drinking. When taken together, doctors warn that these effects may stack, leading to sudden drops in blood pressure that older bodies struggle to correct. Low blood pressure in seniors often presents as dizziness, lightheadedness, blurred vision, or weakness. Research shows that alcohol already increases fall risk in older adults by affecting balance and reaction time. When beet juice is added, the chance of feeling unsteady may rise further, increasing the likelihood of falls, fractures, or head injuries during routine activities. Dehydration is another concern frequently mentioned by healthcare providers. Alcohol acts as a diuretic, increasing fluid loss through urine. Beet juice, while hydrating on its own, also affects circulation and kidney filtration. Combined use may contribute to fluid imbalance, especially in seniors who already have reduced thirst sensation. Dehydration can worsen fatigue. The liver plays a central role in processing both alcohol and nutrients from foods like beet juice. As people age, liver efficiency gradually declines. Medical experts explain that alcohol places a direct burden on liver cells, while beet juice contains compounds that must also be metabolized. Together, they may increase liver workload, which can be problematic for older adults with existing liver conditions or medication use. Cardiologists also caution about heart strain. Alcohol can temporarily raise heart rate and disrupt normal rhythm, while beet juice alters blood flow dynamics. For seniors with cardiovascular disease, these combined effects may increase palpitations or feelings of chest discomfort. Studies on alcohol use in older adults consistently highlight greater sensitivity to its cardiovascular effects compared to younger individuals. Another issue doctors raise is impaired judgment. Alcohol may reduce awareness of early warning signs, such as dizziness or weakness. Seniors may not recognize when blood pressure is dropping too low, delaying rest or hydration. This lack of awareness increases the risk of sudden fainting episodes, which can be dangerous when living alone or moving outdoors. Health experts frequently discourage mixing alcohol with foods or drinks that significantly affect circulation. Beet juice falls into this category due to its nitrate content. Medical guidance often advises seniors to avoid this combination entirely, rather than attempting to space them closely together, as effects can overlap for hours. Avoiding beet juice and alcohol together is generally recommended as a safety measure, not a restriction. Older bodies process substances more slowly, and interactions last longer. By keeping these two separate, seniors reduce unnecessary stress on the heart, liver, and nervous system. This cautious approach supports steadier blood pressure, clearer thinking, and safer mobility in later years. Health organizations emphasize that aging increases sensitivity to alcohol interactions, making combinations more impactful than expected. Studies note that older adults experience stronger blood pressure changes and slower recovery times after drinking. When beet juice is involved, these shifts may last longer and feel more intense. Experts advise seniors to prioritize predictability in how the body responds. Avoiding this pairing helps reduce emergency risks and supports safer daily functioning for aging hearts and minds during later life stages, with greater safety overall. Today, beet juice combined with citrus fruits such as oranges, lemons, or grapefruit can create digestive problems for adults over 60. Due to the interaction between acidity and the aging digestive system, beet juice already has a naturally strong profile, and when acidic citrus is added, gastroenterologists explain that the mixture may irritate the stomach lining and slow proper digestion in older adults. As people age, stomach acid production and digestive enzyme balance change. Research shows that many seniors experience increased sensitivity to acidic foods, even if they tolerated them well earlier in life. Citrus fruits are highly acidic, and when mixed with beet juice, they may overwhelm the stomach's ability to process the drink smoothly. Doctors note that this can lead to discomfort shortly after consumption. One of the most common problems associated with this combination is acid reflux. Gastroenterologists explain that acidic foods can relax the lower esophageal sphincter, allowing stomach contents to move upward into the esophagus. Beet juice may increase stomach volume, and when combined with citrus, this pressure can worsen heartburn, chest burning, or a sour taste in the mouth. Especially in seniors, bloating and abdominal discomfort are also frequently reported concerns. Medical studies on digestion show that acidic mixtures can slow gastric emptying in older adults. This delay may cause gas buildup, a feeling of fullness, or stomach tightness. Seniors often mistake these symptoms for minor indigestion, but repeated irritation can affect appetite and comfort. After 60, medical guidance frequently recommends separating beet juice from citrus fruits by several hours or avoiding the combination entirely. This advice is especially strong for seniors with acid reflux, gastritis, sensitive digestion, or those taking medications affected by citrus interactions. Avoidance is seen as a protective choice rather than a restriction. Health experts emphasize that digestion becomes less forgiving with age. What feels like a mild stomach issue can gradually affect sleep, appetite, and medication reliability. By avoiding beet juice mixed with citrus fruits, seniors reduce the risk of reflux, flare-ups, bloating, and unintended drug interactions. Gastroenterologists consistently encourage older adults to simplify food combinations to support digestive comfort. Keeping beet juice and citrus fruits separate helps protect the stomach, improve nutrient absorption, and maintain medication stability. This cautious approach supports daily comfort, digestive ease, and overall well-being in later years, allowing the body to function with less strain and fewer unnecessary. Thank you for spending these few minutes here. Growing older does not mean giving up strength or comfort. With the right foods and small daily choices, the body can continue to support you well. This channel is here to share simple, research-based guidance that helps people over 50 stay steady, active, and confident. Take care of yourself, listen to your body, and join us again for the next video.